Because you know that so many things happen to Pancho, and I always have to get him out of trouble. Well, let's see what happened to Pancho a little while ago.
No, don't touch it! Come, let's call the ambulance.
You could already see that Pancho was bitten by a dog. They're bringing Pancho to me. I'm waiting for Pancho to arrive to give him first aid. There's Pancho, a dog, a car, electrocuted. Well, what hasn't happened to him? Let's sit him over here and please bring me the tools. To cure Pancho, look what has happened is that Pancho has a bite, obviously. He has bleeding. This is something that can happen to anyone. Thank you very, very much. Well, first of all, thank you. The first thing I'm going to do is to put on gloves, obviously, so as not to infect Pancho's wound. And what you have to think about at this moment is that we have to do some kind of examination to see how serious the wound is. And the first thing I am going to do is that I want to wash the wound a little bit. Pancho, put your arm on it. This can be done obviously with a water faucet. I am going to do it with this water. I am cleaning the wound. Okay? We are going to pass you water. Eventually, if you are at home, please do it with soap and water. You are really trying to clean the wound. If there is any bacteria, some kind of dust, something that could cause an infection, that we are taking it out of there. The other thing we are going to do, if you have a gauze pad, you are going to put pressure on the area that is bleeding. I know it hurts Pancho, but you have to put water pressure on the area that is bleeding so that we can try to stop that bleeding. And that is what I am doing there. That is what you are going to do. Eventually, we are going to assume, obviously, because of time issues, that the bleeding is going to stop. I'm going to clean it up a little bit more. We are going to clean the wound a little bit more. I know it hurts Pancho, so when it is well cleaned, you will do a better job because you have more time. What you will do is that you will give him an antibiotic cream, okay? Because we are trying to prevent infections, which is the most important thing. Now, if you see that it is a wound, in this case, Pancho's wound is not so deep. If you see that it is too deep, and obviously you have to go to the emergency room, we will give you some antibiotic. Topical antibiotic, and eventually what they want to do is put some gauze over it so that the skin really absorbs it. What happens? Every so often, at least 3 times a day, you have to remove the gauze and look at the wound, because if there is a sign of infection, what are these signs of infection? Let's see them on the screen. Swelling, redness, pus. That the patient in this case is Pancho, starts to have fever or increased pain. You have to give him antibiotic, okay? You have to give him antibiotic by mouth, and you have to talk to the doctor about that. The other thing you have to try to see is to ask if the dog had the proper vaccines for rabies, because you know that if they don't have them, you have to visualize that dog for 15 days. If you don't know the dog's history, you have to talk to the doctor, and in some cases you have to give a vaccine. The other vaccine that some doctors give after a dog bite is tetanus. So if you can do it at the beginning with a topical antibiotic, it might be enough to get cured. If it has one of those signs that I told you, you need oral antibiotics, and the vaccines are very important.